Hello, everyone. Welcome back. I'm Dr. Elizabeth Ortiz. I am a rheumatologist with over 15 years experience treating all kinds of rheumatic conditions from lupus to osteoarthritis, vasculitis, and beyond. Here on this channel, I'm dedicated to breaking down complicated autoimmune topics into practical and insightful information that you can then use to make the best health decisions for you in your life. We talk about conditions, lab tests, treatments, and lifestyle changes so that you have the information you need to take control of your health. So today we're talking about gout. Gout affects so many of us and is a common issue in the rheumatology office. So let's get into it. All right, so what is gout? Gout is a chronic inflammatory condition of monosodium urate crystal deposition in soft tissues. The most common manifestation is an inflammatory arthritis flare of intense joint pain, swelling, and redness. These flares can last days to weeks and are debilitating if left untreated. In between flares, people can be completely asymptomatic, but in some, the flares can become more frequent and ultimately lead to more advanced disease where there's evidence of monosodium urate deposition in subcutaneous tissues that we call nodules and persistent joint inflammation and destruction. Whoa. What in the world was all of that? Okay, first, what is monosodium urate crystals and why in the world are they depositing in my tissues? So uric acid is a naturally formed acid that we all produce. When exposed to the right conditions, which are multiple and poorly understood, it can make nice with sodium and becomes monosodium urate crystals. These crystals can then induce an inflammatory response. How does someone end up in a situation where they have lots of these crystals? Well, one way is by having too much uric acid floating around, or we call it having hyperuricemia. So hyper is too much, urus is uric acid, and emia is in the blood. But having too much uric acid in your system doesn't seem to be the only factor because a lot more people have high uric acid levels than have gout. So taking a step back, all of this is to say the joint pain and inflammation we get from gout isn't the result of autoimmunity or your immune system attacking you or due to wear and tear of the joint, but as a result of high numbers of these crystals ending up in certain body tissues and causing your immune system to then go berserk. So side note, this is why I always say rheumatologists take care of autoimmune and inflammatory conditions, because not all inflammatory conditions are autoimmune, at least in the classical sense. So what are the symptoms and then how do we deal? So people's first gout symptoms are usually going to be severe joint pain, swelling, and redness. And I'm talking pain, like I can't even have the sheet touching my skin kind of pain. Now, the classic joint that is involved is the first big toe. When this happens, we use the word podagra, but it can happen in any joint. The joint will be hot, red, swollen, and believe me when I say you won't even want to touch it. It usually comes out of nowhere. None of this, oh, it's been sneaking up on me for weeks. No, it's one day you're great and the next day you can't stand. Without any treatment, these flares will last days to weeks. Usually longer than 4 days, usually shorter than 21. So how do you know it's gout? Well, if the joint involved is the first toe, it's so classic that we don't even need any other information than that. But if any other joint is the problem, or maybe multiple joints are inflamed, then your doctor really should be doing an arthrocentesis to take fluid out of the joint and send it to the lab. In the lab, they can see a number of things. They can see how much inflammation is in the fluid. They can actually see the crystals, and they can make sure there isn't an infection in the joint, because that is a whole other can of worms. Depending on how big of a stickler your doctor is, and for the record, I am a big stickler, then some would say to definitely say someone has gout, they need to have confirmation of crystals in the joint fluid by a lab. Now, if the joint is on your foot or hand and it's challenging and painful to perform an arthrocentesis or to stick a needle in the joint to get fluid out, then even someone like me will let it go. With treatment, which is all focused on bringing down inflammation as quickly as possible, these flares can be brought down to just days. So the treatment during a flare can include colchicine. Now, just a note on colchicine, it's typically recommended that in a flare you take colchicine up to 2 times a day. And slow your roll. I'm not telling you to take it 2 times a day. Depends on how good your kidneys are, so ask your doctor. But typically, the recommended flare dose is twice a day. But just know that I'm so old, I was instructed once by an attending physician to prescribe colchicine for every hour until the patient had diarrhea. So just know, if you have diarrhea, you're taking too much. The second medicine is NSAIDs. These are things like ibuprofen, naproxen, things you can get over the counter. They also have prescription. You can also use prednisone, and that can be either oral or injected. And ice. Don't underestimate the power of ice to reduce inflammation. It's important that during a flare, you continue all your other medications. Now, we're going to get more into long-term treatment in a bit. But if you are on any of the gout medication and you have a flare, continue it. After a flare is resolved, you go back to normal, meaning no joint pain, no nothing. If, however, there was a precipitating factor to the flare and that factor isn't identified and then persists, then the likelihood of having another flare is high. So what are these possible precipitating factors? Well, they're all factors that will affect your uric acid level. So the first one is diet, specifically high purine foods, because we know purine metabolism is what results in the uric acid production. So these foods are like your meats and shellfish. The second thing is alcohol use, especially beer. Third, non-diet sodas with a high fructose sweetener. Also, dehydration can be a precipitating factor, and certain medications like diuretics such as hydrochlorothiazide. Also, just having kidney disease can put you at a higher risk for gout. So let's put some context around this list and give some examples of what kind of situations could lead to a gout flare. So perhaps you have a big night out that includes steaks and drinks. Or maybe you have a full day spent outside at a summer music festival, drinking nothing but Cokes. I'm from the South, so we say Coke really to mean soda. And maybe some cocktails. Or maybe it's a few days after you pick up a new prescription for blood pressure. All of those are scenarios that can lead to a gout attack. For some, gout can become more than just the periodic flare. Monosodium urate crystals can deposit in multiple joints, leading to ongoing joint pain and inflammation and eventual joint destruction. We can also get crystal deposition in our soft tissues. This can result in nodules, otherwise known as tophi, or what I would sometimes call lumps and bumps in my clinic. These can happen around our elbows, our hands, or even our ears, amongst other places. In these kinds of cases, the next group of medications we're going to talk about, the meds we use to lower our uric acid level and prevent flares, are necessary to stop joint destruction and dissolve the nodules. So how do we do that? How do we prevent flares? If you've only had 1 or 2 gout attacks and you can pinpoint to a precise trigger like alcohol or a new medication, then treatment may simply just require removing those triggers. However, if you can't pinpoint a trigger, or you've already removed what you can and you are still having flares, or your doctor checked your uric acid level in your blood and it was high, then you may need more chronic treatment. Treatment that's aimed at preventing flares, not just dealing with them. So again, how do we do that? Well, we need to lower someone's uric acid. And when lifestyle changes aren't enough, we have medications we call urate lowering medications. So first up, we have an oldie but goodie, and that's allopurinol. Allopurinol has been used since the 1960s and has been found to be safe and effective at lowering someone's uric acid level to a level that won't put them at risk for these flares. If someone is continuing to flare while on allopurinol, then the allopurinol dose is likely not high enough. We are getting better, but docs are notorious for abandoning allopurinol too soon instead of maximizing the dose. And a note for those of Asian or African descent, allopurinol can sometimes lead to a hypersensitivity syndrome that can be life-threatening. It's like a very severe allergic reaction. Before starting allopurinol, your doctor should test for a certain genetic factor called the HLA-B5801, which can inform them of your risk of this and then decide if this is a good medication for you. If allopurinol does in fact not work, then there's febuxostat, benzobromone, which isn't used in the US. It's mainly used in Europe and Asia, which is why I can't say it. And then there's probenecid. There's even an infusion medication called pegloticase. Now, pegloticase is a powerful medication that rapidly brings down your uric acid, and I've watched tophi literally melt away in front of my eyeballs from it. But it also can be associated with severe infusion reactions, so really should be handled with care and only used in those cases where it's absolutely necessary. Each of these medications has pros and cons, and figuring out which one or which combination is best for you depends on what other medical issues you may have, what are the medications you're on, and a discussion with your doctor. But just know that the whole point of these medications is to bring down your uric acid level to a point that it dissolves, doesn't deposit in your joints, and then doesn't create flares. Now, a word on the gout patient's general health. Here on this channel, I love to highlight how everything is connected, and that is especially true when talking about gout. Gout oftentimes travels along high blood pressure, kidney disease, obesity, and cardiovascular disease. Medications that we use to treat these other conditions can affect our uric acid levels, both in the positive and negative, and colchicine, a drug we use for flares, can actually provide cardiovascular protection. Oftentimes, as goes one condition, goes the other. So blood pressure gets worse, gout can get worse. I highlight this to say gout is important. It needs to be given attention as more than just a very painful nuisance and as the chronic condition that it is. So I love giving food for thought, things to chew on, think about in yourself, and things to bring to your next doctor's appointment to continue this conversation. So, first question I ask you to ponder, can I pinpoint any trigger that could have led to my gout attack? Was I started on a new medication? What had I drank or eaten in the 48 hours prior? Also, I recommend you keep track of your flares. How many have you had? How often do they come? Keep a diary to share with your doctor at your next visit. This could help guide the discussion about more long-term treatment. If you are already on long-term treatment but are still having flares, keep a diary and ask your provider if there's room to go up on your medication. If your flares aren't stopping, or you start noticing new lumps or bumps around your elbows, your hands, your ears, ask for a referral to a rheumatologist. And don't forget, for those of Asian or African descent, ask for the genetic test for hypersensitivity to allopurinol before starting the medication. Okay, that's just a quick look on gout. I hope you found this helpful. If you did, I'd really appreciate if you subscribe and like, share it with anyone you know who could use some extra information about gout. Like I said, here on this channel, I'm really committed to bringing practical, up-to-date information so that you can make the best decision about your health. Thanks, and we'll see you next time.